I'm Dr. Yi from Layana today. Good afternoon, everyone. I have Dr. Patricia with me, my colleague, who came to me with for the therapy of autologous exosomes. Okay, today we would like to take a little bit of testimonial from her, and let's start off by introducing herself to us. Okay, let's begin with Dr. Patricia.
Okay, I'm Dr. Patricia.
Mm.
I have been a type 1 insulin dependent diabetic for 39 years since I was 13 and a half years old. And I've been on multiple insulin injections since the time of diagnosis up to today. And for about 15 years ago, at the age of 38, I started to get very severe joint pains and aches and frozen shoulder and like multiple joint pains. And after doing blood tests and also ultrasound and radio imaging, I was diagnosed having rheumatoid arthritis. So for the rheumatoid arthritis, I was started on methotrexate. So methotrexate, initially methotrexate, and then when about 10 years later, I was started on Humira, the biologics Humira. So I was taking, during the time when I was taking methotrexate, I felt that it didn't help much with the pain relief because I have to take painkillers every night. I used to take Cerebrex before sleeping so that the next morning it will help to alleviate the pain, and it didn't help much. I was getting such bad frozen shoulder and my wrists, the cartilage in the wrist joint and also in the fingers were eroded. And then later there was fusion of the joints, so it was like so debilitating. And
Sounds like what you call the progress of the disease and the sequelae of the disease get worse over the years.
It seems like it was getting worse. It was not well controlled with methotrexate.
But most of the thing you are getting is more like a symptomatic relief all the way.
And it was just symptomatic relief. The painkiller was just to relieve the pain. The next day, if I don't take, then it will come back again. So I have to be on continuous painkillers. So then later, the rheumatologist was treating me, decided to refer me to a tertiary center for further evaluation. So they decided to do an MRI of the joint, and then they noticed that it was quite severely affected. So, and also the rheumatologist in the tertiary center said that it's not good to take painkillers on long term. So he suggested that I start taking biologics, which is Humira. So he only he just mentioned that of course Humira, I have to be afraid of opportunistic infections and
there's some side effects of the
Humira.
It's the immunotherapy, is it?
But initially when I started on Humira, I felt like the joint pain immediately it was relieved. But slowly I started to get side effects of the medication.
After how long been using Humira, you started to get that side effect?
Okay, I just started Humira about maybe a few months. Then I started to get very severe gastritis. I could feel the gastroesophageal reflux coming up to my throat. And I have to cough and cough and cough. It's like so debilitating and so irritating. Then later I started to get some bleeding of the gums, and then my ears were blocked. And then after a while, I started to get these whitish hypopigmented patches on my face, and it affected my face. And the worst thing is that I was slowly starting to get a bit of like memory loss and a bit of brain fog. And I was feeling so sad and so unhappy, and it was affecting my quality of life. And after slipping and falling down, and in the fracturing my ankle bone.
Looks like everything is getting worse along the way, right? It's not getting better, right?
It's getting like worse and worse. I was just thinking that I actually almost reaching towards the end of my life because like it's like becoming
so discouraging, right?
Yeah, it's so discouraging and becoming so debilitating. And at the same time, I also have to work, and I'm traveling daily, driving, and I have to work, and my work is actually quite stressful also. So then I started to seek some alternative treatment. Totally stopped taking Humira, but I was still taking methotrexate. And then after a while, slowly I started to also wean off methotrexate. So now currently I'm totally off both Humira and methotrexate. I don't need any painkillers, and I'm just taking like a vitamin D. Of course, it's still on a high dose, and of course on the other supplements like magnesium and fish oil and zinc together with the vitamin D. And
What you just mentioned is no more medications over there. It's more on the supplementations.
Yeah.
High dose supplementations.
I mean, I've totally stopped hospital medication and Western medication.
I think those Western medications or conventional medicine give you more side effects than all these supplementation, correct or not? Okay, I guess that how Dr. Patricia came to know about me because I conduct something called autologous. I advocate autologous exosomes training, and she's part of my students as well. Then I'm feeling that after she gave me a call that she's looking for the alternative, I suggest her to do exosomes. It is what made you decide to try this autologous exosome itself?
They will, of course, tell me, yeah, you have to continuously take this. And I was just thinking, of course, if you take steroid on long term, will it cause thinning of the skin and will it cause like more damage rather?
I find it is a very different narrative. Very conventional. We both churn out from the same system. You see, for me, it's more like an immunosuppressants, but we do it in the other way around. We don't suppress the immune system. We work out the immune system to tackle these issues at all.
Then that's when I decided to to seek your exosome treatment.
Okay, I guess that was about 3 months ago.
Yeah, about 3
Just how I
months ago.
started to. I've been doing a lot of regenerative medicine and stem cell. I find it exosome has something that it really intrigued me. It's the ability to reduce inflammation in the body faster than any other regenerative materials. So before you came to me, Doc, do you have any hesitation to start exosome at the time? Did you read a lot about exosome after attending my class? Or you just go and give a shot, something like that?
Actually, I know about exosomes because of the talk that I attended from at the Malaysian Medical Association.
So you are clear that time we are talking about autologous and allogenic exosome, right?
Yeah, I'm quite clear.
You're quite clear,
Yeah. Then I thought maybe I could give it a try, and maybe these exosomes could also maybe rejuvenate my body because of the long-term immunosuppressants that I've been taking for my rheumatoid arthritis, and also the maybe the side effects of the medication and also the side effects of the disease.
Okay.
So that's when I thought that exosomes would be something that would be very helpful for me.
Okay, thanks, Dr. Patricia, giving me a chance to help you out on this one. Okay, tell me your experience describe your experience during the sessions with us the first time.
Okay, the first time, of course, I was not sure what is exosomes. I was so scared when I see the intravenous, what is the exosomes going in. I was just thinking, is it going to cause like a thrombus formation or a clot or something? And is it going to be something that is like beneficial or even worse? So I was a bit skeptical, but then I thought, okay, I will just give it a try. And after the first intravenous exosomes and also to all the vitiligo patches, I just noticed that there's some hyperpigmentation starting to reappear at all the patches.
You started to notice some of the, what is it called, the islands of pigment start to appear and start to coalesce. I saw even today is the third session, probably I would suggest maybe we look into more session later on. We do not know yet. See how you progress over there. You can see what I saw is there are some positive outcomes from that after the sessions. Okay.
And then also, Dr. Edwin, because I'm not sure whether I was having like some very severe headaches and also like almost like some epileptic seizures. I'm not sure whether it's drug induced or whether it's some not related to the Humira and medication. But then I know that these exosomes can actually cross the blood-brain barrier. So that is the only thing that can go through, and maybe to give some hope, maybe to solve to cure the headaches and also the maybe memory loss, brain fog, and all that I've been having after taking all these immunosuppressants.
What from the first session do you see any improvement, or you find it only on the second sessions that
the first session immediately, of course, because there's some abrasions on the face because of the
we do the microneedling.
The microneedling, of course, there's some discomfort.
Yep.
But then I noticed after a week when the skin starts to
Peel off, yeah.
off and starts to heal, then there is a bit of like I can see that there is actually some relief.
Yeah.
And my headaches and the memory loss and the brain fog that I used to have also, I feel that it's like a bit better.
Mm.
Mm.
I guess from to try to understand autologous exosome here is why I advocate autologous exosome. Autologous means the exosome derived from Dr. Patricia itself after we do a preconditions for her for 2 to 3 weeks with a RK series of RK exo. Here that I truly advocate this so-called autologous exosome is first because they have no rejections, is 100% biocompatible to her itself. Secondly, is because this thing stays a bit longer without the rejection, means the cargo delivered by the exosomes stays and continue doing their repair in a longer period of time. Third, is because there's no chance of transmissions of diseases or even no chance of transmissions of other people's DNA. This was the difference between the comparison between the allogenic and the autologous. Okay, so yeah. What about today? You came to me for the third session. I sat down with you that you gave me some form of very positive outcomes already. Can you just repeat one more time on that? After the second sessions coming in, what have you improved?
Okay, I feel that the vitiligo patches are getting less.
Mm.
So that is one thing that I'm very happy because there's
You more focus on that, right?
because there's there was no other treatment before that can the creams, the phototherapy and all that could actually help. And then second of all, I feel that my quality of life is a bit better. I can sleep better.
Okay, good.
And my concentration is better. And I feel even my blood sugar is also better.
Fantastic.
And I generally feel better lah. That's what I feel.
Okay. So what we do here is for Dr. Patricia is because we harvest enough of exosome to deliver to various places. Like first is the intravenous. Secondly, we did is something we call dermapen for her vitiligo. The third one probably we will inject to her joint as well because she experienced some joint pains. What else that we for the thymus stimulation to improve
the nebulizer.
The nebulizer and the thymus stimulation. You can see with autologous we can play around with quantity of exosome that we need as compared to what we buy from the lab. You can see this is the advantage of autologous exosomes. You can see. So what can you do now that you can't before?
I think currently
energy is better. You find it?
Yeah, energy is better. Energy is better. I feel that everything. I mean,
everything is moving positively.
It's slowly coming back to normal.
Yeah,
it's slowly coming back to normal.
Okay, with this, because I'm going around trying to help people with regenerative medicines. Yeah, later on I've talked to Dr. Patricia about the frequency medicine as well. What would you say to someone that are suffering from this similar condition? Would you recommend this treatment to others and why?
Yeah, of course. I at that time when I first started having rheumatoid arthritis, I didn't know about all these alternative medications. So I spent about 10 years taking hospital medicine and Western medication without realizing how much of damage it was doing to my body secretly, because the only thing that the doctors used to monitor will be the full blood count, the liver function, renal function. But I didn't know that it could also go up to the brain, damage the brain, and cause high blood pressure, gastritis, and a lot of other unwanted side effects. So if I had known about all this medication at the start of when I was diagnosed having rheumatoid arthritis, of course, I'll be so happy to have started with all the medication rather than depend on methotrexate, Cerebrex, and Humira and all that.
I guess that I'm pretty happy today to hear all your outcomes, the positive outcomes. We probably will continue to do something else to see there's a further improvement of it. We're definitely going to monitor you. I think Dr. Patricia is equally happy because they've changed her life and improved her quality of life as well.